Dr. Lucy here from Real Life Medicine. Today, World Heart Day. So, this week, we're obviously talking about the heart. Yesterday, I talked about fatty heart, which is something that we don't hear a lot about, but increases your risk of atrial fibrillation. But today, on World Heart Day, I'm going to talk about what heart disease actually is. And there's a few different things that people think about or that we should be thinking about when we talk about heart disease as a problem. So the main thing people think about of heart disease is heart attacks. So that's actually coronary artery disease. That means that little arteries that supply the heart get blocked, and the heart, basically the muscle, dies. And when the muscle dies instantly, the heart can't pump. And depending on how much muscle dies, the person may die. And that's obviously tragic. And that, I think, is what they're talking about with Dean Jones, although I'm not even sure about that because they'll need to have an autopsy. We get a lot of hints. Our body, very bloody kind thing, gives us hints that this may be a problem. And the thing is, people talk about chest pain, right? Chest pain is a really bad phrase because for most of it, it's not actually painful. It shouldn't be called chest pain. It could be called, there's a whole heap of other words that we would use because people, when they think of pain, I mean, pain hurts, right? And honestly, if you're having a full-blown heart attack, yeah, that hurts. But for the majority of people, they get maybe some discomfort. It could be a tightness. It could be burning. And they're not pain. So people go, oh, well, I don't have chest pain. And doctors, we do it all the time. Have you had any chest pain lately? No. I had this funny burning thing, but that wasn't really painful. It's a word that really needs to change, a phrase. It has to come from doctor end. So patient, you are going to be more educated than your doctors because the term pain isn't that helpful. So we talk about discomfort, maybe burning, heaviness. Okay, often heaviness is a thing, and sometimes people come in and they'll go, oh god, it was so tight, I felt like someone was sitting on my chest. For me, that's like, right, that is an alarm bell. So tight, heavy, burning, indigestion. Indigestion is the commonest feeling. So if you get any of those, that, honestly, they need investigating. Don't put them off, okay? Because it may be your body saying, listen, there's something going wrong. Okay, so coronary artery disease causes discomfort of any sort in our chest, and it can even radiate up to your jaw, down your arm, both arms, left more commonly, but definitely both arms. And weirdly, how's this? Once I saw a person and he was having some weird feelings in his chest and he got this sort of funny pain down his arm. I thought, oh, it just didn't feel right. Okay, so we did an ECG, and yes, his heart was unhappy. Okay, he had to go off and have some invasive cardiology testing, and basically he had lots of coronary artery disease, and he would have gone on to have a massive heart attack and possibly die if this wasn't sort of sorted out. So coronary artery disease, really important. And the other thing is, if you get any chest symptoms when you're exercising of any sort, it might be walking upstairs, it might be walking up the hill, it might be walking up your driveway, anything like that then settles when you rest, that has to be, we have to exclude heart. Now, the thing about heart stuff, right, is that a lot of times we're investigating it and it's not heart, and that's great. But it would be terrible to miss something related to your heart, assuming it's anxiety. So I often say to people, look, listening to your story, this is probably chest wall pain or anxiety or something, not your heart. But I can't give you a 100% guarantee unless I check a bit further. Okay, and that may include some tests, like blood tests. It may include well, you should include an ECG and probably a referral to the cardiologist to have a stress test. Okay, so sometimes we're looking at heart stuff. We think it's probably not, but it needs to be excluded. So that's coronary artery disease. The other sorts of heart stuff, we talk about heart failure. God, that sounds like a sad word, doesn't it? Oh, my heart's failing. But honestly, what it is your heart is a pump. Okay, and if the pump isn't pumping properly, okay, so it's not up to its full stretch, then your circulation around your body isn't as good. So people end up then with some fluid in their lungs or in their legs. And that's kind of heart failure. There's multiple causes of heart failure. Coronary artery disease is one, because if you imagine if you have a little, you might have a little heart attack, you don't die, but a bit of your heart muscle does. So the pump is not going to be as effective as it used to be. There's genetic causes of heart failure. There's, interestingly, viral things. You can get a virus that gives your heart what we call a cardiomyopathy, which means the heart muscle is damaged and it doesn't work as well. So we've got coronary artery disease, we've got heart failure as our two things, and then there's rhythm disturbances. Okay, some of these are genetic-y things. We talked about atrial fibrillation yesterday and the causes of that. Now this is a little talk on a big topic, but they're the sort of three main things: so coronary artery disease, heart failure, and rhythm disturbances are the things that we need to be really looking at as a beautiful, healthy heart. So what can we do to prevent these? Okay, so the key, we want to prevent heart disease. Heart disease is still the leading killer in Australia. It's crazy, okay? We've got this beautiful organ. We always talk about it. We always talk about love, and when everyone thinks about love, they go straight to their heart, okay? So we want to love our hearts. What can we do? I'm going to tell you the number one thing that you can do to love your heart is stop smoking or never start. Okay, I know everyone knows about smoking and everyone thinks about it as lung cancer as well, but it's seriously, smoking, it is toxic poison to your whole body and in particular your beautiful heart. So lots of ways to stop smoking. Okay, I do hypnotherapy for smoking. It's highly successful, but you need to want to do it. Okay, so stop smoking. Number two, okay, and I see a few people in here that are really onto this. Okay, a few of you lovely ladies. Number two, blood pressure. Okay, hypertension or blood pressure is the way blood pressure hurts our heart, multiple reasons. But the first thing is, if you imagine you've got a pump and it's having to pump against a higher head of pressure. Okay, so every day, every beat, this heart, instead of just being able to go whoosh, it's having to go whoosh, whoosh, whoosh. So you can imagine every day, every beat, days, months, years, it changes the muscle around the heart, and the heart gets a bit stiff. Okay, and we call this diastolic dysfunction. The heart does not like it. The other thing that blood pressure does is increase your risk of coronary artery disease, so those plaques forming. Okay, there's two, well, I'll go into that in a little bit. So that needs to be sorted. And then the third thing, close to my heart, is managing blood sugar and managing your insulin. So metabolic syndrome, which is a combination of symptoms that includes high insulin, fatty liver, dyslipidemia, which is abnormal triglycerides and low HDL, and hypertension in here. Those three things together are the number three, the three top causes of heart disease. I know we talk about cholesterol in there, and I'm going to do a little tip of the hat to cholesterol. Okay, cholesterol, everyone, and honestly, Australians, you are such good people. You have all talked, you all know about cholesterol. It's the number one question I get asked. Lucy, what about my cholesterol? Cholesterol is super important, but I'm going to give some caveats here. It's not the number one thing that we need to be worried about. The number one thing is insulin, smoking, and what did I say? And hypertension. Insulin, smoking, hypertension, a little brain fade there. So please make sure you're onto those. You can do that. Insulin, how do we do insulin? You know, I'm talking about it all the time. Low carb, real food. That will fix your insulin. Glucose control. If you've got type 2 diabetes and your glucose is not controlled, your arteries are in dire straits. So control your glucose. Control your blood pressure. Stop smoking. Cholesterol is interesting. If you have familial hypercholesterolemia, i.e. a gene that puts up your cholesterol, there's a bit more to it. It's not as simple as you've got high cholesterol, therefore you can have a heart attack. But we do know those families are more likely to have heart disease and they need monitoring. Okay, I have plenty of people in my practice with cholesterols that are what would be considered crazy high, 8, 9, even 10. And we check what are the other risk factors, what else is going on, how healthy are their arteries. It's not enough for me to go, well, oh, your cholesterol's high, here's a statin. Okay, that's ridiculous. But I'm also not going to go, well, your cholesterol's high, but I don't believe in statins, so I'm not doing it. That's also ridiculous. I need to know what are your absolute risks. So the things I will always do, if somebody comes in with high cholesterol, I will do an LDL subfraction, which tells us whether they have big fluffies, okay, big fluffy LDL or small dense LDL. Big fluffy LDLs are like clouds and they just go by. Small dense are like ball bearings and ping into the artery wall. I will also do a coronary artery scan, okay, a coronary artery calcium score. Okay, a coronary artery calcium score tells me, do you already have plaque? If you already have plaque, it's a whole different kettle of fish to if you don't. Okay, they're two separate people. Okay, if you have plaque, then you've got coronary artery disease. Sorry. If you don't, then you don't have coronary artery disease. And they're two different groups and we should be managing them differently. Okay, so you need to know, do you have coronary artery disease? Yes or no? All right, lovelies, I've rattled on. It's 13 minutes, but it is World Heart Day, and I am passionate about looking after hearts, passionate about looking after your whole metabolic process. So not just your heart. Your heart is absolutely crucial. Obviously, without it, we die. But we also die without everything else. We die without our brain. We die without our liver. We need to look after our body as a beautiful, holistic organism because that's what it is. So wonderful, peeps. Go forth. Have a beautiful, heart-healthy day. And I'll see you tomorrow. Bye, darlings.